Hello, everyone. Thank you so much for joining us today. I am Eva Freed. I'm the clinical director for midwifery and women's health nurse practitioner programs here at Frontier Nursing University. And I want to welcome all of you to our 9th annual virtual midwifery event in celebration of National Midwifery Week. And happy National Midwifery Week to all of the midwives out there. And thank you, everyone, for joining us. The session that you're here for today is called Mindfulness Self-Care for the Provider, which I'm sure we can all agree is critical to our continuing to deliver great care to everyone who comes to us. We have 3 presenters today, all of whom are Frontier Nursing University faculty and also themselves certified nurse midwives. They each have extensive and impressive bios, but I have picked out just one little thing about each of them to share with you that's related to the topic today. Dr. Nicole Lassiter has a personal meditation and mindfulness practice, which I'm sure will inform what she shares with us today. Dr. Katie Moriarty has spoken nationally and internationally in multiple venues about stress, anxiety, and coping. And Dr. Anna Verzone has her own integrative medicine practice in Anchorage, Alaska. So I know that all 3 of them have a lot of information to share with us, and we're so glad that you're here.
My name's Katie Moriarty, and my partners as well, Nicole Lassiter and Anna Verzoni, are presenting. So this is for 1 credit hour, and we have no conflicts of interest, and the course will expire October 3rd, 2024. We have our objectives here, and we're just going to spend some time reviewing some information with you and evidence. And we've tried to scaffold that information between the 3 of us, and then spend some time doing some experiential practices as well. So the real why this topic is needed is that healthcare workers and practitioners we have so many stresses. We're filled with work-related distress, shortages that can really impact an individual's mental and physical health. The U.S. Department of Health and Human Services has really acknowledged that working in healthcare for many is inherently stressful, and those working really are suffering from fatigue, exhaustion, burnout, and actually some even have confronted many repeated ethical dilemmas. By 2030, worldwide demand for healthcare workers will increase to 80 million, but only 65 million will be supplied. So, really amounting to a net shortage of some 15 million workers. And the World Health Organization estimates that nurses and midwives will represent the largest percentage of that deficit. And these shortages are obviously from hospitals and clinics to public health departments, and it's really going to affect all levels of care in our population and worsening an already problematic health disparities and access issue for underrepresented communities. So there's varied reasons for the shortages. We have an impending onslaught of boomers retiring, liability issues for some, provider burnout, geographic clustering in metropolitan areas, and then leaving some rural deserts. There's organizational and occupational sources of work-related psychological distress, and for many, a real sense of chronic stress. We have a range of stresses and stressors, and some of them are systems. So people can have workload and client acuity issues, a negative working culture with issues with collegial relationships, or sometimes a mistrust between providers. There can be a mismatch of philosophical beliefs in an area where you're working, a lack of sense of autonomy, work-life balance or imbalance. And traumatic births can really impact providers on a psychological and a professional level. So psychologically, providers can experience compassion fatigue, secondary traumatic stress, post-traumatic stress disorder, depression, and anxiety. And professional ramifications can span from changing the way you actually practice, some people stopping attending births, returning to staff nursing, or shifting to administration, leadership positions, academia, and even early retirement for some individuals. Student stress can be somewhat different. Obligations can range from financial to conflicting demands from family and work. Clinical stress due to a mismatch with a preceptor, clinical practice issues, conflict with their own expectations of stepping into the boots of being a provider. Some traumatic birth experiences, sometimes they can feel outside of the team, and extended duty hours. And in the last couple of years, we've all faced major challenges with COVID. And on a daily level, we open up the newspaper and see client-related disasters which impact individuals, families, entire communities in our nation. Among healthcare practitioners, more than 50% of nurses, physician assistants, and physicians report symptoms of burnout. And we see individual as well as organizational costs from that. On an individual level, I've mentioned some, but fatigue, memory deficits, depression, anxiety, sleep disturbance, irritability, substance abuse, and even suicidal ideation. On an organizational level, costs include poor patient satisfaction and employee outcomes such as a lack of compassion and care, missed work days, diminished work performance, and high turnover. So, links between stress and health, while much remains to be learned, current knowledge makes it clear that addressing the effects of stress, particularly chronic stress, can play a critical role in realizing someone's health potential. So stress, as a review, can be experienced as acute or chronic, and both evoke similar endocrine and hormonal responses. However, with chronic stress, after activation, the cortisol levels remain elevated and can be particularly damaging to our health. So elevated cortisol levels impair memory function, elevate serum glucose levels, suppress immune system functioning, along with fat redistribution to central and cervical spine regions. This impact on glucocorticoids exacerbates chronic conditions such as hypertension, diabetes, obesity, anxiety and depression, and even the suppression of reproductive functioning. So what can be done to kind of reduce the adverse effects of stress, overwhelm, and burnout? Obviously, reducing some of the stressful conditions, but also by increasing a person's individual capacities to meet the challenges in their lives. So mindfulness meditation has the potential to decrease stress and burnout in healthcare practitioners by decreasing self-judgment and over-identification with experience, and by increasing resilience, compassion, and emotional regulation. So we often think of this as a useful tool for our clients, but we need it as well, and so do our students. So now we're seeing definitely an increasing interest in the use of mindfulness to improve healthcare practitioners and students' well-being, and also examining how it can impact academic performance and prepare beginner health practitioners to be reflective, empathetic, and patient-centered in their practice. So resilience is your ability to recover quickly from problems or difficulties and to enhance coping with life. And you can learn resilience, and practice will enhance it. So mindfulness originated from ancient Eastern and Buddhist philosophy and dates back about 2,500 years. And the concept of mindfulness has been inspired by many. We just really wanted to mention a few. Herbert Benson is considered kind of the pioneer of mind-body medicine. And Dr. Benson defined that relaxation response, kind of the physiological counterpart of the fight, flight, or freeze response. John Kabat-Zinn, kind of the creator of the mindfulness-based stress reduction program, and at the University of Massachusetts Medical Center, he created the Stress Reduction Clinic and the Center for Mindfulness in Medicine, Healthcare, and Society. And then Ellen Langer, who's often coined the mother of mindfulness, and she's the first woman to have been tenured in psychology at Harvard, and is well renowned for her studies on illusion of control, decision making, aging, and mindful theory. So, mindfulness is one modality that's been utilized as a path to reducing suffering and developing a sustainable, resilient self while we learn and utilize skills to assist increasing self awareness, enhancing regulation of responses and impulses, and a deepening compassion for ourselves and for others. It's kind of a type of balanced awareness that neither resists, avoids, or exaggerates our moment to moment experiences. And John Kabat Zinn writes that mindfulness involves paying attention in a particular way, on purpose, in the present moment, and non judgmentally. So, one aspect that can help with staying in the moment or staying in the here and now is breathing, and we can use it kind of as an anchor. So the breathing process can be trained, and effects of diaphragmatic breathing, in part due to the vagus nerve and parasympathetic stimulation, helps to stabilize the autonomic nervous system, increases heart rate variability, decreases systolic, diastolic, and mean arterial blood pressure, improves lung function, improves immune function, um, uh, blood flow of the blood and lymph, and improves digestion, improves onset and maintenance of sleep. The mindfulness-based stress reduction program developed by Kabat-Zinn in the 70s is the most widely used mindfulness meditation modality and serves as kind of a blueprint for many modern mindfulness programs. So mindfulness-based stress reduction consists of engaging in guided meditations focused on cultivating non-judgmental awareness. So the traditional program's 8 weeks long. You have weekly 2.5 hour sessions with daily meditations, both formal and informal. And some of the formal things can be an intentional sitting, standing, lying down, where you're focusing on your breath, your bodily sensations and sounds, other senses and thoughts and emotions, and movement. And informal can sometimes just be mindful awareness to daily activities such as eating, exercise, chores, or relating to others. There's also a 1 day retreat that lasts about 6 hours. And on the left-hand side of the screen, you can see some of they're called attitudes of mind. So they give us kind of a touch point to refer to when we're practicing, and working on one really enhances them all. So we have a rapidly growing body of literature that's identified a range of beneficial outcomes for the regular practice of mindfulness meditation. Some of the physiological changes include reduction in cortisol levels, improved immune function, reduced blood pressure. Some of the psychological benefits have been reduced anxiety, stress, depression, improved regulation, and a sense of well-being. Brain imaging studies have discovered both physical and functional brain alterations in adults who've practiced 30 minutes of mindfulness meditation for 8 weeks. Some of the reported outcomes include decreased amygdala response to emotional stimuli, greater gray matter density, cortical thickening in the insula and the prefrontal cortex. Imaging studies have shown that mindfulness meditation calms a part of the brain that triggers fear and anger and increases brain activity associated with positive emotions. In a systematic review and meta-analysis of randomized and non-randomized studies involving healthcare practitioners by McConville and colleagues, there were there were 19 studies included and just under 2,000 participants. And the review of the controlled studies identified positive outcomes of mindfulness training in relation to decreasing anxiety, stress, and depression, and increasing positive mood states, self-efficacy, mindfulness, and empathy. And the changes in anxiety and stress were maintained at follow-up, and self-efficacy actually improved at the follow-up. The one type of mindfulness that had the largest effect was when someone used the entire program of mindfulness-based stress reduction. Possibly that's from the multidimensional approach, which actually helps to kind of show people the evidence behind it. You introduce varied mindful practices that they can utilize, such as body scans, mindful meditation, and mindful movement. And then also kind of that debriefing and sharing of the experience with the peers. They found that the decreases really from this study of stress and anxiety and the increases in mood occurred irrespective of the study group, meaning whether they were medical students, psychology, nursing, or allied health, and also found in varied populations. So whether you lived in the Southeast Asian country, the US, or Australian, where the intervention had been based in either mindfulness-based stress reduction or mindfulness-based cognitive therapy. The focus was on quantitative data, so kind of the lived experience wasn't really explored, which would have added a lot of depth to this data. At the beginning of most mindfulness classes and courses, we introduce this practice, and we're going to do it right now, where we're actually take time to mindfully eat a raisin. You can use anything. Sometimes I actually like doing it with an orange as well, but it's where we're using all of our senses, seeing, touching, hearing, smelling, and tasting. It can sometimes feel odd, but we're trying to use a beginner's mind to this experience, and it helps in some ways to demystify meditation. So you can use whatever you have with you, if you have a piece of food or if you have a cup of tea or anything like that. So we ask you just that when you're practicing this, you're going to put aside your distractions, you're going to turn your phone off, clear awareness on each moment, and really try to be present. So we would just place, a raisin in your hand or whatever food you have. And now with your food in hand, you're going to just really begin to explore it with all of your senses. So focus on it like you've never seen it before, as if you're discovering its newness kind of for the first time. So you're going to just turn it over, turn it around, look at its color, looking to notice its folds where the surface reflects light, becomes darker, exploring the texture, feeling any softness, hardness, coarseness, or smoothness. Sometimes when you're doing this, you might think, why am I doing this exercise, or this is weird, or how can this possibly help me, or even maybe, gosh, I hate raisins. That's okay. Just acknowledge your thoughts, let them be, and bring your awareness back to the object. So just put it beneath your nose. You want to pay attention to the smell. Put it near your ear. You want to squeeze it, roll it around. Do you hear anything coming from it? You want to put it in front of your lips. Maybe notice if your mouth is watering at all. You want to gently place the object in your mouth or on your tongue, and without biting, just really kind of explore that sensation of your mouth. Feel the texture, the smoothness, the crevices. Again, maybe notice any emotions that you have. Do you feel any impatience, any anticipation, any resistance? Just acknowledge your thoughts if you have them, and then shift back to the sensation of the raisin. And when you're ready, we just intentionally bite down on the raisin. Notice slowly chewing it, being aware of the saliva, how the consistency is changing. And when you're ready, just go ahead and notice that intention to swallow. Go ahead and swallow it. Really just congratulate yourself for taking the time to experience, mindfully eating something and bringing focused attention to each moment, observing kind of the three pillars of that experience of body sensation, thoughts, and emotions. And this exercise is hopefully thought to help to become more aware of the interconnections between them. I'm going to give you guys some homework later this week. Maybe try to do this again, and just really try to not multitask when you're eating your lunch, and just really try to take the time to slow down your eating, and go through that process again.
Okay, thanks for that, Katie. That was great. I'm Anna Verzoni, and we're going to dive into a different kind of mindfulness practice called mindful self compassion. And this body of research was initiated by Kristen Neff at the University of Texas at Austin and Chris Germer at Harvard. And they developed the mindful self compassion program in 2010. So let's start with the working definition. What is compassion? Strauss et al. In their 2016 meta analysis concluded compassion consists of 5 elements: recognizing suffering, which is a type of mindfulness, understanding the universality of human suffering. Another way to say this is acknowledging common humanity, feeling for the person suffering, tolerating uncomfortable feelings, and motivation to act or alleviate suffering. The Latin roots of compassion literally mean to suffer, passion, with compassion. So the interconnectedness of compassion is essential. And through this, when we're able to see the other as a fellow human being, and we feel less alone. So let's suppose you see a homeless person asking for money on your way to work. And rather than rushing past them or passing judgment, oh, that person's a drunk or an addict, we may actually stop to consider how difficult their life may be. We get curious. What's their story? The moment we see the person as an actual human being who's suffering, we connect and we're moved by their pain and we want to help in some way with a feeling of compassion. Instead of pity, we say to ourselves, they're a human being just like me. So there's not a hierarchy, right? If I'd been born into different circumstances, or maybe had just been unlucky, I might also be struggling to survive. We're all vulnerable. And in this model, it doesn't require us to always give money, but a cornerstone is no one has to earn the right to compassion. It's our birthright. We're human, and we all have an ability to think and feel and have a desire to be happy. And this warrants compassion for its own sake. All of us, including you. Now, mindful self-compassion, or MSC, is the same compassion directed towards ourselves. We have a clear seeing of our own suffering, a caring response to our suffering that includes the desire to help ourselves, and recognition that suffering is part of the shared human condition, not to minimize our own suffering, but so that we don't feel so alone. And we use the term suffering loosely. It can be any moment of pain or discomfort, large or small. So suffering can be going on when we're considering personal inadequacies, like mistakes we all make, failures we all have, as well as when we're confronting more painful life situations outside of our control. Now, I'm from an immigrant family. My mom came here from the Philippines when she was 35. And in our community, we were taught, oh, we survive because of grit and being able to deal with suffering and bucking up and pulling ourselves up by our bootstraps. And all those things, many of us here to keep us going when we're about to give up or when things seem hard. So when I first heard of mindful self-compassion, I was like, what? Maybe this is just an issue for people that have a lot of comfort and privilege. But I was wrong. I eventually found out that indeed research showed it actually helps everyone be even more resilient, and more on those additional benefits in a bit. So these are the elements of mindful self-compassion. As you can see, it relates to the definition of compassion from the meta-analysis earlier. MSC works because when we practice the 3 components, mindfulness, being aware we're suffering, self-kindness with kind words, soothing touch, and common humanity, recognizing we're not alone, we deactivate the threat defense system and we activate the care system. And each of these directly counteracts fight, flight, or freeze. And I'll show you more about how this works in a couple of slides. Now, because of its ability to deactivate the stress response, we see lots of benefits. Here are several studies that support an application of mindful self-compassion to decreasing burnout in nurses. We know that it acts as a protective factor against PTSD in soldiers. Yes, they're teaching it to soldiers to decrease the incidence of PTSD. We see improved resilience, decreased stress hormones, increased heart rate variability, which is a sign of healthy response to stress, and increased capacity to be in our parasympathetic nervous system of rest and digest, connection, and care. Now, like I mentioned earlier, I had several misconceptions of the utility of MSC, as do probably many of you. One is that self-compassion is a form of self-pity, but self-compassion is not a woe is me attitude. It actually helps people engage in perspective taking than focusing on their own distress. And another misperception. Oh, it makes people weak, but it offers resilience, and self-compassionate people are better able to cope with tough situations like trauma, divorce, or pain. Some see self-compassion as selfish or self-indulgent, but we actually lessen our sense of separation from others in MSC. And self-compassionate people tend to be more caring, more likely to compromise, more compassionate towards others. So isn't that interesting? We can't give to others what we can't give ourselves. Now, what about making excuses? Self-compassion actually provides the safety, the emotional safety that people need to admit mistakes. So they're more likely to apologize if they've offended someone and not blame someone else. Now, a lot of us are also motivated by stress and fear, but self-compassionate people are more motivated to change because they're motivating from an internal encouragement instead of with harsh self-criticism. Now, motivation by stress and fear works in the short term, but in the long term, it's not sustainable and it leads to poor health outcomes. Self-compassionate people don't beat themselves up when they fail, so they're more likely to take risks and try again and persevere. So it's not for wimps. It's for everyone who wants to be able to access their full potential in this lifetime without being motivated by fear. Now, according to Paul Gilbert, who created compassion-focused therapy, when we criticize ourselves, we tap into the body's threat defense system, sometimes referred to as our reptilian brain. This is why MSC is helpful for people who have a loud inner critic, and it can take us out of our reptilian brain response. And the threat defense system of the reptilian brain is the quickest and most easily triggered by all of the threat responses. Now, this exists for a reason. It works well for protecting against threats to our physical bodies, like a mountain lion. But nowadays, most of the threats we face are challenges to our self-image or self-concept, or more abstract things like stressful emails or job security. This means that self-criticism is often our first reaction when things go wrong with threats to our self-concept. We start shaming ourselves, blaming ourselves, pointing out all the ways that we did something wrong. And this system evolves so that when we perceive a threat, our amygdala, which registers danger, gets activated, and we release cortisol and adrenaline, get ready to fight, flee, or freeze. But a stress mind, a mind in fight or flight, and a highly emotional state is not an intelligent mind. It's not accessing our wisdom. So we don't have as great of access to our executive functioning, our prefrontal cortex, that helps us make more logical, rational, and wisdom-based decisions. And when we're from the limbic system, we make decisions based on our default mode and reactivity. So feeling threatened puts stress on the mind and body, and chronic stress, as we saw, can cause anxiety and depression and other chronic health issues. So this habitual self-criticism is so bad for emotional and physical well-being, and why MSC can help with this. All right, luckily we're not reptiles, but we're mammals, and mammalian young are born really immature and have a longer developmental period to adapt to their environment. And to keep the young ones safe in this vulnerable period, the mammalian care system evolved to prompt parents and offspring to stay close and to bond. And it's a great resource for our bodies and minds, this bonding. Two reliable ways of activating this mammalian care system is soothing touch and gentle vocalizations. Think of a mama cat purring and licking her kittens. So in MSC, we teach things like soothing touch, like putting a hand over the heart, giving ourselves a hug, which for you skeptics releases oxytocin in the same way as getting one from someone else. And the gentle vocalizations are speaking kind words to ourselves. Oh, I'm sorry you're suffering right now. The worst part is over. How can I help you, right? When the mammalian care system is activated via self-compassion with the soothing words and soothing touch, similar benefits result. Oxytocin's release, endorphins are released, and this helps reduce stress and increase feelings of safety and security. And you might think, hey, lions don't have self-compassion. You're maybe right, but lions are also able to shake off trauma, and then they get on with the day. Humans are gifted and cursed with a cerebral cortex that excels at remembering difficult events, imagining possible future traumatic events that didn't even happen, and holding on to trauma. And the book Why Zebras Don't Get Ulcers by Robert Sapolsky is a great intro to this concept if you want to explore that. Okay, so here's a good graphic to help you see how MSC activates the mammalian care response and counteracts the stress response. And I'm going to go from bottom up on the slide. When the stress response, fight, flight, freeze is triggered by our threat to our body or our self-concept, we're likely to have unhelpful reactions, which you can see in the middle column. When the stress response is fight, we fight ourselves via self-criticism. When we flee from others, we isolate. When we freeze, we ruminate and get stuck in the stressful event and replaying it. These three reactions are the opposite of the three components of mindful self-compassion. Self-kindness in the form of kind words and soothing touch, like we discussed in the previous slide, common humanity, I'm not alone, and mindfulness, I'm aware that I'm having a moment of suffering. So these are the antidotes to the stress response and can help you and your clients be more able to step out of the threat response mode. Now, if you're still not sure how you'd show self-compassion to yourself, one of the best ways to think of this is, how would you show up for a friend if you were facing the same problem? So we're often more harsh on ourselves, saying and doing things to ourselves that we'd never say to our best friend, like, you deserve that, or you really screwed up, you're hopeless. So when we're stuck, we can kind of think of what we'd say to a friend. Oh, I'm sorry you're going through this. It's going to be okay. How can I help? What do you need? We might give them a hug or hold their hand. So if you're stuck, think not what you do unto you, but how you do unto others in this case. All right, so let's put this into practice. This is an exercise called the self-compassion break. It harnesses the power of soothing touch to help us feel safe and cared for. We also use kind words, mindfulness, and remember common humanity during difficult times. All right, so think of a situation in your life that's causing you stress, maybe a health problem, a relationship problem, a work problem, or some other struggle, and choose a problem in the mild to moderate range, not a big problem, because we want to build the resource of self-compassion gradually. Visualize the situation clearly in your mind's eye, and feel free to pause the video if you need to. What's the setting? Who is saying what to whom? What is happening? What might happen? Can you feel discomfort in your body? And if you don't, try to pick something a little more challenging. Now, starting with mindfulness, try saying to yourself, oh, this is a moment of suffering. Oftentimes we're in a situation and we don't recognize it. Like, I'm actually suffering right now. I'm not just in traffic. I didn't just miss an important appointment. This is a moment of suffering. And maybe you can speak words to yourself like, ouch, or this hurts, or this is stressful. Now, try saying to yourself, suffering is a part of life. I'm not alone. This is part of common humanity, and remembering we're not alone. You might want to say, oh, everyone experiences this, just like me. Or this is how it feels when people struggle in this way. So we have mindfulness and common humanity. Now, offer yourself a gesture of soothing touch. We're entering into self-kindness. So there are many ways to do this, but we can start with just exploring three, and you could choose what feels best. Try placing one hand over your heart and feel its warmth and its comforting pressure. You can even try putting another hand over that and see how that feels. You can also try giving yourself a hug. I was surprised how good that felt. I was like, well, it always has to come from someone else, but it doesn't. You can also try holding your hands in your lap and just giving it a squeeze. So pick one just for this exercise, and you can explore other types later. Now with kind words, let's say, you might say, may I be safe? May I have ease? Find words using language that's effective for yourself personally. You don't want to have an internal argument like, I don't like that wording, or I don't know if it works. Choose what works for you. Some people prefer the word struggle to the word suffering, or prefer the word support or protect to the word kindness. So just try a few. Some other options might be, may I accept myself as I am? May I begin to accept myself as I am? May I forgive myself? May I be strong? May I be patient? And if you're having difficulty finding the right words, imagine that a dear, dear friend or loved one is having the same problem as you. What would you say? What simple message would you like to deliver to your friend, heart to heart? And see if you can offer the same message to yourself. So we recall a difficult situation, or we're in one. We recognize we're having a moment of suffering. We recognize, and there are so many others suffering just like me. I'm not alone in this. And then soothing touch, activating the mammalian care response. And then soothing words. It's going to be okay. You did your best. What do you need right now? And that's it. That's the self-compassion break. This can be done really quickly. Sometimes I do it at a red light if someone just cut me off or before I step out to get the next patient, if I just had a difficult interaction or stressful phone call or email. So, practicing self compassion in these small moments of difficulty throughout the day helps us practice more frequently, which helps build the resilience and have less stress as well. Okay, now for mindful movement.
Thank you so much, Katie and Anna. Those are fantastic exercises. All right, so I'm Nicole Lassiter, and I'll be doing the last section on meditative movements. And while there are many types of meditative movement in this part of the presentation, we will just learn two simple yoga and qigong practices. So meditative movement may include the intentional release of tension from the body, integration of breath awareness with bodily movements, as well as mindfulness and meditation techniques. Many of the benefits are similar to those gained from the mindfulness techniques reviewed just now in this presentation from Katie and Anna. Now, according to the National Center for Complementary and Integrative Health, research suggests that yoga may support mental and emotional health, healthy habits, overall wellness and quality of life, healthy weight loss, good sleep, physical balance, smoking cessation, treatment of substance abuse, and yoga may also reduce stress, musculoskeletal pain, depression and anxiety, menopausal symptoms, and symptoms of chronic disease. In ancient spiritual tradition from India, yoga in Sanskrit means to unite and focuses on the unity of body, mind, and spirit. In the US, the focus has primarily been on physical and mental awareness. So there are three yogic components: asanas, which are the physical postures, pranayama, the breathing techniques, and dhyana, which is meditation. Many picture the more challenging physical postures when considering yoga, yet there are equally effective simple postures, especially when combined with breath and meditation techniques. One of the most widely known yoga poses, downward dog, might have earned its nickname from our furry friends. The most recent CDC survey data from 2017 indicates 14.3% of the US adult population practices yoga. Note, however, the majority of the data has been gathered from high-income, well-educated, non-Hispanic white female populations, and there is a strong need for diversity in studies, specifically on lower-income minority groups. Evidence indicates that yoga is an effective stress management and reduction technique. A 2017 meta-analysis and systematic review of 42 randomized controlled trials found modern yoga improves the state of the autonomic nervous system and supports regulation of the HPA axis, thereby decreasing physiological stress markers. Increases in positive neurological and hormonal changes have also been noted. A 2018 systematic review of 14 studies representing over 1,000 adults from diverse demographics and stages in life and age, including nurses and healthcare providers, found modern yoga practice enhances positive mental health indicators such as mindfulness, affect, resilience, well-being, life satisfaction, self-compassion, and ability to empathize. Overall, the evidence on the safety of yoga is reassuring. However, given the variations, it can be difficult to compare the data. Also, underreporting of injuries and adverse events is possible. A 2015 large systematic review found no differences, though, in frequency of adverse events between those who practiced yoga and those who didn't. And among those who practiced, adverse events were uncommon. Another large systematic review in 2018 concluded healthy people should have no restrictions, while those facing serious acute or chronic illnesses should confer with their medical provider prior to initiating practice. So on that note, Let's practice. This is a simple asana, mountain pose. It's often the start to a practice or done in between postures to kind of clean the slate. Let's start with your feet together or slightly apart, depending on what feels right to you. What's important is that you feel strong and stable and balanced. So first, lift your toes. You can do this with shoes on or shoes off. Spread them apart and then press your toes into the ground. This is where the term you often hear in yoga, grounded, comes from. Notice the four corners of your feet. Press those into the ground as well. Stand tall. Place your arms at your sides as you see in this image. You can open your fingers or just relax them softly. Palms out, facing forward, and then lengthen and lift up your spine. Often you can also open your chest with your shoulders back, which can help lengthen the spine. Staying in that position, go ahead and draw your belly button into the spine, engaging your core. Now, this is where you may notice you're not breathing deeply, or maybe you're holding your breath. So you should bring in the breath from the beginning, in through the nose, and then exhale out through the mouth. And just try and breathe easily as you stand in mountain pose. Imagine a string at the top of the head, pulling your head up towards the sky, but never straining. So you want to be strong, you want to be stretched, but you also want to be relaxed in your body, letting go of tension. So many of us will notice we have our shoulders up towards our ears. So just let your shoulders go soft. You can even roll them back if you need to pull them away from your ears and relax them. Keep breathing in through your nose, out through your mouth, in whatever way is comfortable, whatever pace is comfortable for you. Be aware of your breath. Inhale through your nose and out through your mouth. And think of yourself as strong and tall, like a mountain. Wonderful. Good job, everybody. So now, the second meditative movement we'll review is Qigong, an ancient practice in traditional Chinese medicine with roots in Asian cultures. The word qi represents one's vital energy or life force. Gong defines an effortful, committed practice. Interest in Qigong is on the rise. Practice is easily accessible with no equipment requirements and offers numerous simple exercises that focus on one's qi and regulation of the body, breath, and mind. There are many similarities between Tai Chi and Qigong, which are often referenced together in the literature. Preliminary evidence suggests Qigong shares similar benefits to those associated with mindfulness meditation, improving mental and physical health in both healthy adult populations as well as those with chronic illnesses. While the exact etiology is unknown, it's likely the deep, regulated breathing in coordination with slow bodily movements results in decreased stress-related stimulation of the HPA axis, as well as reduced inflammation and activation of stress pathways. A small prospective randomized controlled trial of nurses suffering from emotional exhaustion during the COVID pandemic tested the intervention of a Qigong exercise followed by independent practice in comparison to a non-practicing group. A validated burnout tool revealed emotional exhaustion was significantly reduced in the intervention group. The authors concluded that, quote, Qigong may be used as a complementary tool to support nurses and the healthcare system, end quote. So on that note, let's practice a Qigong exercise. So today I'll review a simple technique called flowing breeze swaying willow. All right. So you can take the same position as with mountain pose. That's a wonderful way to start. Grounding your feet into the ground, feeling your strength, lengthening your spine. In this one, however, we're going to step out, and it's very easily explained. So if you can't see all my movements, that's not a problem. You're just going to step out a little wider than shoulder stance. And you're going to bend your knees. So go ahead and bounce a little. It's not a big bounce, but you also don't want straight legs, so that you don't want to be hyperextending the legs or the knees. So just a nice, soft, relaxed bounce. Now, your arms should be relaxed at your sides. And all this is simply swaying. Letting your arms sway as you twist your torso side to side. And just like with yoga, notice if you're holding any tension, let that go. It's normal to have lots of thoughts running through the head and parts of the body getting tense. That's okay. The practice is to notice that and then to let it go, and to use the breath in through your nose, out through the mouth, to help distract you from tension or stressful thoughts. So imagine, just like this image, that you are like the willow tree. So your trunk is strong, but you're swaying. Your limbs are your arms. Your arms are the limbs of the willow tree. And you're swaying in the wind or the breeze. You can experiment with either slowing this movement down or speeding it up, whatever feels right to you. But generally, the idea of Qigong is to slow movements down, regulate your breathing, and do that all together in coordination. And that's what changes these physiologic positive markers. All right, well done. So this exercise is also something you can do in short periods of time. All right, so in conclusion, increasing numbers of adults in the US are seeking out non-pharmacologic means to reduce the impacts of high stress arousal states experienced in today's modern lifestyle and healthcare environments. While more research and robust studies are needed, current evidence suggests opportunities in these low-cost, highly effective, and largely safe methods of meditative movement. And in conclusion to our presentation today, the practice of mindfulness, which requires careful attention to the present moment, can decrease ruminative thoughts and anxiety, promote a safer work environment, improve patient care by reducing distraction-induced mistakes. Mindfulness can also promote emotional flexibility, which enables individuals and providers to gain more control over one's response to negative emotions and challenging situations, which we know there are many. Mindfulness can increase the individual's ability to examine one's experience without judgment or attachment. And this non-judgmental perspective promotes a positive, compassionate relationship with the self, which can extend to others, both personally and professionally, as well as improve relationships with loved ones, patients, and coworkers. We've introduced just a few of the many options to integrate mindfulness into daily life. Whether you have just a few minutes or a longer period of time, there are numerous beautiful options to practice mindfulness.
Okay, and here are our references. We provided an introduction to various mindfulness practices that can benefit you as a provider, but there are many deep rabbit holes that we can go down if you want to dive into this further. So feel free to explore any of these references to find out more because there's so much out there. And we find it really fun to explore all of the different tools that are available.
We have a lot of references, as you can see. I just wanted to really thank Nicole and Anna. I really do feel very relaxed. Both of you have very calming voices, and I agree. I felt the self hug, and I loved the willow tree. So thank you. We do have the evaluation. You'll go to post-test and attestation, and then you'll be able to get your continuing education. And we just really wanted to thank you guys for attending, and we really hope that either you're currently using mindfulness or this has piqued your interest in a couple varied methods and modalities that you can explore. And we've really enjoyed spending this time with you. Thank you so much.